Hi, my name is Sarah McSparin, and throughout the course of the semester, I've been researching anxiety of COVID-19 and how it relates to media bias. At first, there was no reason why I chose this topic other than COVID-19 has been a hot topic recently. But after doing some literature review, I have found more compelling evidence to why this research is important. Now I will share with you some of the literature I have found that had made this research so compelling. Media bias has been well documented for decades. Media bias was documented in 2005 by Jenskow and Shapiro. They observed that news reports about the same topic of the Iraqi war by Fox News, the New York Times, and Al Jazeera conveyed very different messages and portrayed very different impressions about the events. In 2017, Castaneda and Martinelli researched media as a business, political, and entertainment model. They concluded that media is a marketing tool for political influence. The media firms exploit political leverage by participating in a type of auction that allocates favorable coverage among competing politicians. According to research in 1997 by Althede, fear was way more frequently present in the media than it was a decade from when their research was conducted. Imagine the amount of fear that is present in our media today. It would be reasonable to assume that it would surpass the amount documented in the research by Althede. He claimed that media is a problem machine. He says that this fear is good for news industries, social control agencies, and claim makers to turn alleged problems into much larger issues. Research by Iyengar et al. Further provides evidence that news programs have the power to shape the public's agenda. In their research, they successfully primed their participants into finding more importance to certain national problems by increasing the amount of coverage on that topic. Mass panic. Hussein et al. Discusses the reasons and the consequences for mass panic. Mass panic is usually created by misinformation, rumors, exaggeration, and fake news circulating in social media and traditional media outlets. Consequently, it has triggered panic buying, racism, and mistrust in the community. Mass panic disrupts supply chains of necessary items and leads to unnecessary hospital visits. We see this personally with the mass stocking of toilet paper and disinfectants. Hospitals and primary cares are overrun with worried visitors. You could be waiting in the line for hours at a local COVID-19 testing facility. Harper et al. In 2020 investigated the role of political ideology in changing behaviors in response to COVID-19. This was the closest research that I found relating to this topic. The researchers found that political orientation was unrelated to behavior change due to COVID-19. The political context in their sample does not reflect that of the United States, because 80% of their sample were British. They suggest that future experimentation should be considered. Now, I will go through the methods of this research study. The participants had an inclusion criteria. The criteria for inclusion was that the participants must have been 18 years or older and must have received majority of their COVID-19 information and updates through a news source, whether on a TV broadcast or on the news channel's social media page. The participants were reached by social media. The survey was posted to multiple social media pages. The survey reached Illinois residents. The information that was received from the participants included basic demographic information and additional information such as their political orientation and what their preferred news source was. The participants were also asked to take the coronavirus anxiety scale to measure their level of anxiety due to COVID-19. Participants were compensated by the chance to win a $30 gas card in a one-time random drawing. One of the materials used in this research study was the Coronavirus Anxiety Scale developed by Lee in 2020. The purpose of Lee's research was to develop and evaluate the properties of a brief mental health screener that health professionals and researchers could readily use to identify probable cases of dysfunctional anxiety associated with the coronavirus. The 5 strongest anxiety symptoms were chosen for the scale because they well exceeded the criteria for psychometrically sound items. Not only does the coronavirus anxiety scale questions focus on anxiety and trauma-related reactions, but they also emphasize distressing bodily symptoms, making the scale highly relevant to somatic symptoms and related disorders. The other material used in this study was MarketWatch's media bias chart. The media bias chart was used to scale where a participant's preferred news source fits on a liberal to conservative scale. This chart uses all major news media sources and plots them based on partisan bias and their overall quality. This research will focus on the x-axis, which is partisan bias. This axis is separated into 7 sections. These categories were put on an interval scale ranging from -3 to +3, with -3 representing most extreme liberal, 0 representing neutral, and +3 representing most extreme conservative. The design of this experiment follows a correlational design. The predictor variable is the level of bias of a preferred media source, and the outcome variable is level of anxiety of coronavirus. The predictor variable was measured by the media bias chart, and the outcome variable was measured using the coronavirus anxiety scale. Research was conducted in a one-time period from October 23rd to November 10th, which was 2 weeks and 4 days. This research had minimal risks. The survey questions may have induced anxiety for participants who are fearful of COVID-19. All participants were compensated by the opportunity to win a $30 gas card and a one-time random raffle drawing. All responses remain confidential. No one has access to the identity of the respondents to their survey submission, not even myself. Participants were registered for the drawing by a link under the section of the survey called Gas Card Registry Link. This link opened a separate form where they inserted their email address. During the course of the 2 weeks and 4 days, 100 responses were collected, and this is the basic demographic information. The participants' ages ranged from 19 to 80 years old. 77 participants were female, 19% were male, 3% were non-binary, and 1% were transgender male. Out of 99 participants, 94.9% were Caucasian, 4% were Latino or Hispanic, 2% were African American, and 1% was Pacific Islander. Out of 99 participants, 38.4% had an undergraduate degree, 26.3% had a graduate degree, 22.2% had a high school diploma or GED, 7.1% had a certificate, and 6.1% had an associate's degree. Out of 99 responses, for marital status, 61.6% of the participants were married, 28.3% were single, 6.1% were divorced, 2% were separated, and 2% were widowed. Now let's go through the results of this study. The results indicate that the predictor variables, age, gender, education level, political orientation, and media bias together were statistically significant predictors of anxiety due to COVID-19. The 5 predictor variables together explained 20% of variance in the coronavirus anxiety scale scores. On the research question, is the level of bias of a person's preferred media source a good predictor of anxiety due to COVID-19? This study found that it is not. The variance for anxiety of COVID-19 that is explained by media bias does not have a statistically significant difference from 0. The p-value found was 0.69. Although none of the trends in this study were statistically significant, there were interesting correlations to note. There was a negative relationship observed between media bias and anxiety of COVID-19. As the bias of a preferred news source sways more conservative, the lower the scores on the coronavirus anxiety scales were. This suggests that as a news source increases in conservative bias, level of anxiety decreases. And as a news source increases in liberal bias, anxiety of COVID-19 increases. Another interesting correlation found during this research study was that the predictor variable most responsible for the variance in the coronavirus anxiety scale scores was education, with a t-value at -1.71. This suggests that as the level of education in participants increased, the scores on the coronavirus anxiety scale decreased. There were many limitations to this study. The study was conducted under rigorous time and monetary restrictions. These restrictions limited the access to data collection and analysis. Another limitation of the study was the lack of research on the topic. Lack of research limits the expectation of effect sizes and comparison statistics. This study also included analysis of self-reported data. Self-reported data may contain bias such as response bias and social desirability bias. This study also had an insufficient sample size, causing it to be underpowered. Underpowered studies can affect results of detecting statistically significant effects. These results, therefore, need to be interpreted with caution. These findings are rather disappointing regarding COVID-19 research, and thus many suggestions are available for future research. There are still many unanswered questions about the factors related to COVID-19 anxiety. Future studies on the topic of factors associated with COVID-19 anxiety and other anxiety in relation to other public health crises are highly recommended. This research intends to help bridge the gap between public's fear of coronavirus and how it is directly related to media bias. Future research should take factors related to fear in a public health crisis into consideration. Finding evidence to these factors may be beneficial in mitigating future illnesses. Other implications to research studying factors of fear in public health crises should also mitigate the effects of mass panic.